And of course, let me say good afternoon, good morning, good evening, wherever you are, how best listening. And this is the OSA broadcast of Star TV Liberia, here in Banga, the central region of Liberia. And we are in conversation with one of the medical personnel in the county, and who is also the CEO for the Children Health Foundation here in Bon County. And my name is J. Prince Papa. I'm here with Martin Sevru, and together we bring you the edition of this live stream talk show right here. So, welcome. You are live on Star TV, Africa News, and KMTV Live. Welcome.
Thank you very much.
Basically, introduce yourself to the people of Liberia, most especially Bon County.
My name is Nathan Willie. I'm the founder and CEO of the JAH'S Children Health Foundation, our own Liberia-based and foundations in Bon County.
Basically, give us a bit insight about the JAH'S Foundation, beginning with your personal, engagement since you started your medical activities in Liberia.
So, JAH'S Children Health Foundation started in Zoita, Bon County in 2014 during the Ebola crisis. We opened as a drugstore at the time. We used to be called the Giant Medicine Store. During the Ebola crisis, the need we saw, the people were in dilemma as to where they can go for medical treatment. When all of the private government hospitals were closed in the district, that is 5 districts in Bon County, we decided to open as a clinic so that we can be able to attend to those citizens that are found within district number 1 and its surrounding. From one thing to another, in 2021, based on our effort that we applied, the Liberia Medical and Dental Council were able to accept our application in collaboration with the Bon County Health Team. At the time, Dr. Azua Quaid was serving as a county's medical officer, and we did our registration as a clinic.
So, since you started the clinic or maybe the foundation, how is it been like for you in terms of your activities in the county?
I actually faced some challenges, but by the help of God, that is Jehovah, we have been moving by the help of other insurance companies, the SAI children, and the county health team supporting, and we have our suppliers from Morovia, the BVN pharmacy. They actually been helping us in our attack.
You talk about challenges now. Let's get it straight. In terms of medical supply or the different treatment being held at your clinic, what are some of those different treatment on a daily basis are given to those who come from their respective places or locality within the county or any part of Liberia?
So we have the clinic located in Zoita, Bon County, and the pharmacy, which is the headquarters, is in Banga. And in the same Zoita, we have another pharmacy.
Okay.
So in the clinic, we have the medical lab setup that we do some routines lab and also some extended lab. So the treatment given to those who seek medical treatment at the facility is based on what is being diagnosed by the laboratory technician.
Okay.
So some of those tests that are done there, the urine is done, stool is done, we have some serum tests done. There are many tests that we can do based on the patient's names.
We have a lot of clinics and hospitals in Bon County, but to be specific, having such in Zoita, what does it mean for the people of Zoita, most especially District 1? Because we are told that District 1 have 4 administrative districts. So what does it mean for the citizens of District 1 in particular?
It's a blessing to the people of District number 1. Because during the Ebola crisis, when we opened, we have people coming from even mentional Nema countries and Grand Bassa
Okay.
are crossing over coming to us. At the present, people are still coming from those localities. And like for when we talk about essential drugs, because our mission statements which says that we should be able to bring essential drugs accessible and affordable to the people of both countries and its surroundings. Those essential drugs are provided on affordable prices.
Okay.
So, like for the pharmacies we have in Zoita, for example, we have paracetamol, which is sold for $50. If you have a prescription from any other clinic, whether it's a government clinic, it's a private clinic, the issue is prescription. One prescription is given from a facility, they sell to you two for $50. As ORS also two for $50. And for amoxicillin 500 milligram, you see for $100, which is affordable.
Now, there are many people watching you from diverse places, the diaspora and other part of the world. And perhaps we have maybe sons or daughters living in Zointa. So in terms of communication, in terms of contact, by what means, if somebody have issues and want to reach your clinic, by what means can they contact you?
We have the organizational hotline.
Okay.
So we have Orange and we also have Lone Star. So the Lone Star number is 087 42 6000. And we also have 077 840 1442.
Quite recent, we just let's say ended the leap year. So, could you mind giving us one or two success stories from the beginning of the year 2024? Could you mind giving us one or two success stories on some instance because we are now in 2025? So, perhaps maybe success story about the year 2024. Perhaps you may encounter with.
So one of the success story that we have that is beneficial to our people, especially for government employees, like the teachers, the nurses who are found in that area. By the help of our brother, one of our brother from the district, who directed me in meeting the manager of site in children, that enables those citizens that own those in children from government, they are able to be treated at the facility. Yeah, imagine people used to come from Zointa, come to Banga before they get treatment, especially for insurance patients. So if the child is sick or you yourself sick, look at the distance from Zointa to Banga here will cost you like $1,000. And you have to come moving around, go back the race. But we take it as a improvement for us and one of our success story. That at least our people can be able to get treatment from their own community.
Now, we are in 2025. What's your innovations and what do you expect in the next 3-4 years to come? And before you just elaborate, in terms of, let's say, connections, is there any international or national support to your foundation?
Not yet. There's no international support or local support, but we depends on the drugs revolving funds that we have as a foundation to be able to pay our staffs. We have over 25 persons that work with the JAH'S Children Health Foundation. So by the help of the drugs revolving funds we are able to pay our staff.
So how qualified and efficient are your staff in terms of, let's say, their medical status?
Oh, they are people that are licensed by the Liberia Board of Nursing and the Doctoral Board. That we have a cohort of doctor who is a surgeon, specialized surgeon. He is one Dr. Wu, who works at the CB Doma Hospital, covered the clinic. We have the OIC, she is a PA, and she is appointed Ward T Ward. She serves as a PA, and we have another second stringer who is a lesson nurse. He is one David Topa. So I myself am a professional person. I'm a nurse, BSc nurse, and the epidemiologist.
So let's get to your plan of actions for the next 2, 3 years, and what's your expectation?
Our goal is by 2030,
Okay.
we should be able to extend to other parts of Liberia. And by 2020, before 2030, we have decided to relocate the clinic in Zointa, opening a health center and a academy that will help less fortunate people in the community to be able to attend. Because looking at people in our community, the people who graduated from the senior high school in the district, some of them don't have money to move to other community like for Bangat and other places to go to school. And I took a tour in the district. I observed that children under 5 years of age are not going to school in the district. Our agricultural corporations gave us the right to open the school, the mission school. So we will open as a mission school where you will bring the child, do the registrations of the child, and leave. After maybe a semester, then you come and pick up the child during the semester break. So there where they will be like living, and we will almost have the academy. We have people trained in other activities.
So, well, folks, wherever you are, how best listening, we are in conversation with Mr. Nathan with it right here. So you can make a comment. You can make a comment. Definitely, it's gonna be read. So, like you talk about building a foundation in the long run. So, what have you seen in the district, and what do you think is the cause sometimes for kids not attending school? What do you think is the problem from your own perspective?
So some could be there is no up to standard daycare within the community.
Okay.
So children going to elementary schools and their parents have to go on the farm. They believe that those kids are very little, that they remain on their own, go to school and follow them on the farm. So they prefer carrying them on the farm than going to school. Because if you send the kids to school, you expect the kids to come from school and follow you on the farm. And they also depending on farming to survive. They can sit by the child within the community, child go to school, come back before they go home. So I think that is one of the reasons. There's no up to standard facility that will hold the children that the parent will be able to do other works.
So what's a call to national government? Because sometimes we feel that despite the various clinics and health center that is being built by, let's say, private individual at time, need to be assisted by the government by employing some of, let's say, doctor and nurses. So from your end, how do you see it? And what's the call to national government?
So in recent time, the Ministry of Health through the Bon County Health Team requested for at least 2 persons from the foundation clinic to be employed.
Okay.
And their data were also sent to the county health team, which we are waiting, and we are appealing to the government, not only JAH'S Children Health Foundation, there are other private health facilities that accelerating the effort of the government when it comes to health in our community. So they should be able to help employ some of them, like BAFTI. I compare the BAFTI, that the BAFTI clinics in Banga have really been doing well. And the government is also helping them too. So they can also help other private health facilities so that they can improve in terms of inspection, in terms of supervision, so that they all can be part of the health system.
Now you are part of the Bon County medical team. We observe that there are other people who sell drugs in buckets, sometimes in the cartoon, in the street, which of course we feel that is not safe. So, what's your advice? What's your advice to those who are involved in such act? Selling drugs in the street, let's say in buckets, sometimes in plastic, and sometimes people don't know the harm, the uses of those things, and at the end of the day, at time when you take them, it become a problem. So, what's your core advice to those who are involved into that? Is there any penalty prescribed by the Ministry of Health and Social Welfare against those who are involved into such act?
Actually, there's a penalty, and the Liberia Health Regulatory Authority, they are responsible to give awareness to those guys that will be able to leave the street. So that for some of those guys who sometimes come at the foundation pharmacies to buy. So I told them you have to make up your mind to go to school so that you can be able to do the real thing.
Definitely.
Because if you are not schooled to do the real thing, you may not be harming other people, you may be also harming yourself. So my request to the government, there are people who have the ambitions to become medical people. That those guys, it's very difficult to remove them from the, let's say, to move them from the street. Because just imagine places that they train in Nima County, there is no clinic. The cross come to Bone County before they can seek medical care. Black vehicles go in those places. So the government will find another means that yes, say you have the interest that you want to do medicine, you can go to school. Open a school. Open a school. That at least you can help those who are really in need. But the penalty is if they grab you, what they do to you, take the drugs from you, and it is a right of the Liberia Medical and Dental Council to take you to court because you don't have the lesson.
So, what are different issues, or maybe something you want to talk about that we did not ask through your deliberation? Maybe extra messages from your end to share with the people of Liberia.
So, as the CEO, we have started engaging private health facilities and public hospitals so they can join us in the JAH'S revolving fund. Then we started with CB Doma Hospital. They can attest, the administrators and other people in Banga can attest to that 6 months, from 6 months up to this time, CB Doma Hospital have not been giving a prescription out for people to go out to buy drugs. Okay. Because we signed an MOU with them that we can supply them on a reasonable price. Because it's a drugs revolving fund that they are running, especially they have the community pharmacy in CB Doma Hospital. So we supply the community pharmacies with those essential drugs and other medical material, the laboratories material. So we have our donors. They are almost like our donors because they gave us the drugs on a reasonable price that at least we can give it to and people can afford. I tell you, for free. You go to CB Doma Hospital now, you carry the 1,500, you will take your treatment. Because we signed the MOU with them that we can supply them any other drugs that they need as essential so that at least affordable to the people of Bone County and its surrounding. So we also want to talk with other private health facilities that they can join us. We can make a difference in Bone County if we all can come together and, man, medicine. You don't join medicine because you want to make profit or you want to be rich. If you want to be rich, then it means that you want to kill. Because there are people who don't have money. There are people living in Bangladesh just on $1, United States dollars. Some use $150 to eat. They find money to eat. So if you have the drugs and you think that you will come into medicine by making profit, nothing. It means that you're going to kill. But we, as a foundation, have come to Bone County to be able to help our people in Bone County, that we can bring essential drugs affordable and accessible to the people of Bone County. We are located on the boulevard right before the Far East Junction. So people who want to understand more about JAH'S Children Health Foundation, they can visit our county office right there.
So at this moment, like I said, there are many people watching from diverse places, even the CEO for Star TV Liberia. So like you talk about helping to also supply some of those private institutions, and also you mentioned your hotline. But for here, in terms of getting you, by what means again can they get you? Because maybe you only call you one number at a time, may not also be possible. So what are those different numbers you have that you can be contacted at any point in time?
Okay, so we have the hotline, as I said first, which is 088 7 42 We have 077 For my personal number, you can get me on 0886 630453 and 0776 826514. Or you can email me on nathanwillie45@gmail.com, or you can also reach the organizations on that's a JCHF Foundation 2023@gmail.com.
Yeah, so someone requested, Honorable Dixon S. Doe requested that you also want to at least see a bit of the, let's say, the view of the pharmacy at least to also know the place. So he requested that we can also at least view the pharmacy.
So you are welcome.
So thank you. We'll be back to you within a subsequent time. So folks, just keep tuned as we for at least the pharmacy to bring you actuality. This is it. This is it.
Sorry, please. Sorry. No.
So well, folks, that's it. And so let's get the parking comment from the CEO for the JAH'S Children Health Foundation in Bengal. So that's it. As you just let's say see what we just put out. It's a very beautiful place in Bon County, and I think the citizen of Bon County is making much more use. So what's a call to people of Liberia, most especially Bon County, taking advantage of let's say the pharmacy in terms of getting drugs on a daily basis? What's a call?
We are appealing to them because we have to appeal for the health of the people. To get essential drugs, you can visit the JAH'S Children Health Foundation pharmacy at the Baltimore Boulevard, and also visit at the Cocoyard Road where we have the medicine store. Also, because people crossing from the Cocoyard Road coming on the boulevard is a distance and risk is involved. So we also have another branch on the Cocoyard Road where they have the biohabilant fee.
Okay.
So you can also visit there and be able to get your essential drugs for affordable price. People living in Nima County and Grand Bison, especially for the Dim Sums region, you can also visit Zointa. Opposite the Lutheran Church in Zointa before reaching the market, we have the pharmacy also there for the same price we sell here. It is the same price we sell in Zointa. So you can also visit our clinic at the Koi Park in Zoisno Junctions in Zointa. It's a very fun, beautiful clinic. When you reach there, you will almost want to stay.
So just before we leave you finally, your parking comment.
So I just want to say, we appeal to the national government that they will involve private health facilities, especially when it comes to reporting in the HMIS tools. So the HMIS tools in the Ministry of Health is a kinds of tools that report. That means you see that all government facilities will report through that HMIS tool. It helps to see the surveillance. They will be capturing surveillance also. But there are private health facilities in Banga here who are not reporting from the HMIS tool. So the data that's supposed to be reported by the Ministry of Health through the county health team, it is not being reported. There are some deliveries that are also done by private health facility. There are some surveillance cases that are being arrested by private health facility. They cannot be reported. And there are some reported cases and some cases that are supposed to be reported that surveillance of the county will take action on. So it's only by including the private health facilities and other NGOs forms in Bon County into the HMIS that will help the county health team to get more data, and it will better their data.
So just before we leave you, your name again?
My name is Nathan Willie, the CEO of the JAH'S Children Health Foundation.
It has been a pleasure having you live on Star TV Liberia, in the central region of Liberia.
So thank you very much. I myself am happy today, at least for the first time, to appear on the social media that days where at least our people will be aware of the JAH'S Children Health Foundation and what is our goal and what we are intending to do for the people of Bum County and its surrounding.
It's a pleasure.
Thank you.